I wanted to stay at home.
She sounds really good. Hi, baby.
I wanted the baby to decide when she wanted to come.
My daughter came into this world. For the time that she did. And I can't bring her back.
Thank you, everyone, for joining us to discuss Pieces of a Woman. I'm Reddy Ann Simon Play, culture editor at Now Magazine. I'm joined by Kevin Ritchie, who is the editor of Now Magazine, as well as two midwives who have experience with delivering babies. Manavi Handa, who practices in Toronto and is also a professor at Ryerson, or faculty at Ryerson, teaching about midwifery. And Hannah Lang, who used to practice in Toronto, but is currently practicing in northern BC. Welcome to you both.
Hi.
Just to let me walk, just to, kick off our sort of side of this. Both Kevin and I saw the film at the Toronto Film Festival back in September. And so, Kevin, do you want to set up the movie?
Movie about a sort of suburban, middle class, upper middle class couple who the movie opens, they're buying a new car. It's sort of, you get the sense that they are starting their new life together as a couple. She's 9 months pregnant and they're putting together their nursery and like framing the ultrasound photo. And they've decided to have a home birth. And when she goes into labor, the midwife that they have is busy doing another labor. So they get a different midwife you get a sense they've met this midwife, but that she's the main character played by Vanessa Kirby isn't totally comfortable with her coming. Nonetheless, they don't seem to have any choice. So they get this midwife played by Molly Parker arrives. The husband is played by Shia LaBeouf, who's like a kind of blue collar kind of construction guy in the movie. And they go through there's this sort of 30-minute home birth scene where the baby is born and delivered, but then dies before an ambulance can arrive. There's complications with the heart rate of the baby in that scene. This is a spoiler, but it's sort of the most, but the movie actually really isn't about this incident, in that there's sort of a trial where the midwife is charged, I believe, with manslaughter. But the movie kind of shifts and becomes more about the grieving process, and the director and the screenwriter are a couple, and they have said this is a sort of fictionalized version of their own loss, in that the screenwriter had a miscarriage. What interested in me in talking to both of you especially was that pop culture representations of pregnancy, childbirth, midwives, obviously a lot of people, that's their exposure to midwifery. They don't know a lot about the process, especially in North America. And what I've read is that in the UK and in the Netherlands, you see like maybe 80% of like childbirth are have a midwife, but it's way lower in North America and Ontario. Is that accurate, would you say?
I mean, in Ontario now, we're at around like 15% of all births. So it's way lower than 80%. The other thing is, in the UK, almost everyone has a midwife, but they don't have home births. They're nurse midwives, and so it's in the hospital setting.
So maybe just start off and explain for people listening, what is a midwife, and why are there so many misconceptions around what a midwife does?
So I think one of the biggest things is that midwifery in North America, Canada was the last G7 country to legalize midwifery. So it's only been legal here for just over 20, like almost 25 years. So, which is pretty young for a profession. And at 25 years, we're now doing around 15% of births. And Hannah, in BC, it's 20%, right?
Yeah, I think it's around 2022. Yeah.
But it's really like, when I started practicing, I was 3 years. The midwifery program had only existed for 3 years. There were 80 registered midwives in the province. Now we're almost at 1,000 registered midwives in the province. So it's not like the last 20 years it's been as popular and as common as it is now. So I think a big part of it is the midwives who used to practice before legislation only were able to do home birth. There wasn't regulation, so they had different levels of education, different levels of equipment. And we also have to remember that in medicine, there was a very kind of well thought out plan to eradicate midwives. I mean, this is, a few decades ago, but part of that plan was to say that midwives were uneducated, to say that home birth was unsafe. And that kind of stereotype still exists, that idea of either the witch midwife or the hippie midwife or the kind of lay village midwife. Those are the three kind of tropes about midwives that are still, I would say, prevalent. And so I would say most Ontarians, and especially like me being South Asian from an immigrant community, for sure people know less about midwifery in general, but lots of people don't realize that we're covered by the government. So in BC and Ontario, if you have a midwife, you don't have to pay. It's a 4-year university program, which is like medical school, undergraduate medical school, that people just don't understand that. They still have these kind of now quite dated ideas about what a midwife is and what a midwife does.
And how many births that you attend to are happening at home versus in a hospital?
So interestingly, it really varies. I think the provincial average is about 20% at home. The practice I'm at, I think we do 5 to 10% at home. We work with a lot of newcomers, a lot of new immigrants and refugees, and definitely I would say in newcomer communities, there's less interest in home birth. There's a much higher interest in hospital birth. And, some people are like, we've come here for technology. In many ways, we want as much technology as there can be. So they would choose more home birth. And Hannah, what is it in northern BC where you are?
The community that I'm in right now, we have a huge catchment area. I would probably say around 10%. But the hospital that I work out of is a A1 site. So that means that we don't have access to section or epidural.
It's a
so in some
way
ways, yeah. So in some ways it's similar to home birth every time in terms of management and risk screening and that kind of thing.
Can I ask something about the stat when you said that there's about 15% of people use a midwife in Canada? Is that number also skewed because of a lack of availability of midwives? Because I understand one of my friends who wanted to have a midwife birth couldn't find one. There's just huge waiting lists for midwives.
So it's not 15% in Canada because some provinces are just newly legislated, but Ontario and BC,
okay.
Ontario is around 15, BC is around 20, 25. Yeah, I mean, I think the stats in Ontario are 40% of people who want a midwife can't get a midwife because we're very coveted. So it's interesting in this way, there's all these stereotypes about midwifery, but then people who know midwifery and understand midwifery have have very high rates of wanting midwives.
So can you explain just for people who don't know what you do, because your midwives are healthcare professionals, like you said, and there's this sort of idea of these Zenda women or hippie dippies in the movies or TV shows, but obviously that's not.
And not to be confused with a doula, by the way, because that was a big thing for me. Midwife doula, are they not the same thing?
So doula provides labor support, but doesn't do anything medical. Yeah. A midwife, I often describe it like everything that a family doctor, in general terms, anything that a family doctor used to do in terms of birth, and family doctors have left obstetrics in droves. And so we've kind of filled that niche of lower risk, normal, healthy pregnancy and birth. So we do everything, like order all the tests, prescribe medications, everything from the very beginning of pregnancy until 6 to 8 weeks postpartum. And so that also includes everything for the baby. So ordering all routine tests for the baby. And, you know, this was one of my big things with the movie, which is just, it's so classic in these movies. There are certain tropes about midwives and clients. Of course, the client is always a middle upper class white client. They never show any diversity that way. And the midwife is also always white. They never show that there are midwives like me who can be brown. But they always, like in the movie, there were 3 pieces of equipment that the midwife had. She had a stethoscope, she had a Doppler to listen to the baby, which she didn't actually really use that much, and blankets. Like where we, and when Hannah was saying that where she works, it's similar to home birth, we carry the equivalent of a level 1 hospital of equipment with us. So anything and everything you would need up to the point of a cesarean section, or a vacuum or forceps. So we can prep someone for C-section en route to the hospital. So we have IV equipment, we have oxygen, we have very extensive training in neonatal resuscitation. So that was another thing where when the baby stops breathing in the movie, she's just like, please, baby, breathe. Like, it just makes it sound like, you know, we're just praying to the universe and have no skill to actually help the baby start breathing. So we have really extensive skill, and up to the point where midwives now can do point of care ultrasound. Like we have an ultrasound machine at our clinic where I can, you know, double check the baby's position, for example. We can assist at a cesarean section, so we can be the assistant to the physician. In some cases, we do expanded scope, so we can do vacuum deliveries, which, you know, is not the most common, but certainly we can, our skills are much beyond what is ever shown, I would say. Like you would never, I don't think I've ever seen media representation of a midwife prescribing medication or a midwife sending someone for an ultrasound, where those are very everyday that we do. Hannah, do you have anything you want to add?
Yeah, it made me anxious in the movie when she arrived, and I was like, where are you going to set up for a recess? Like, where's your equipment? Because that's really like one of the first things. If that baby comes out and needs help, it's not going to work if it's all in your bag. And so that point of the movie definitely made my blood pressure go a little bit higher. Also, that baby looked like it was like 3 months old.
Yeah,
Isn't
that's
that the case with all movie babies?
Yeah, I guess so. But I was like, what? Come on, guy. And the belly really, I was like, that is not a very good belly.
Well, what did, you know, there's I guess, what sense do you get that people that you work with, that how influenced are they by pop culture in terms of the decisions they make around their pregnancies and where they may want to have their baby, at home or not? Do you find that media representations influence parents to be?
I think that there's still a general lack of awareness around what our scope is as a midwife. And Brad, you mentioned the confusion between a doula and a midwife. Like the paramedic at the hospital the other day called me a doula. So that's definitely something that we're still working against. What I will say is that folks that have had experience with midwives talk about their midwives to their friends, to their family. And I would say that word of mouth is typically how most people come into midwifery care, because the level of care that we provide is just so good. Like I think it's as simple as that. Like we're really good at what we do. And in Ontario, there are 3 pillars of midwifery care, the philosophy. It's probably similar in BC, but I was trained in Toronto. Continuity of care. So generally you will have met your midwife before you go into labor, hopefully more than once. Informed choice. So one of the things in the movie that really also bothered me was the lack of consent with a couple of the vaginal exams, and choice of birthplace. So because of those 3 pillars, I think basically we've designed a system that serves women really, really well. and people talk.
When you say choice
And-
of birthplace, then there's this sort of contentious scene towards the end of the film in the court case where the lawyer kind of puts the mother on the stand and says, you refused to go to the hospital when your midwife recommended it, although there is some cloudiness where the midwife said it or the husband recommended it before the midwife could ask. Can you talk a bit about that in relation to the film, like where maybe there is a situation where you would have to change location to going from home to the hospital? How common is that?
So I think
what's the sort of process?
Yeah, one of the big things about midwifery care in Canada is that midwives deliver babies in the hospital and at home. And so in that case, your midwife would be admitting you into the hospital and following you throughout the care if there was an emergency. Yeah, that scene in the movie was kind of difficult for me to remember. What we know is that based on the research and based on the evidence, home birth is a safe and responsible choice. The AOM has some really good documents available for the public that sort of outline that the extensive research that's been done on outcomes. And basically what we know is that with a midwife, outcomes at home and the hospital are the same. And actually there are some people's experience of home birth generally are more positive than in the hospital.
Not just that, actually the evidence shows, and we have really good evidence supporting the safety of home birth. And part of that is we don't stay home when there's an emergency. And one of the things that really bothered me in the movie was this trope of the unreasonable, selfish woman who's having a home birth against all costs and not thinking primarily of their baby, which is so rare that I would say in 20 years, I've come across it a couple of times, and usually it's when you're also dealing with mental health issues or extreme trauma around the hospital. And even then, you wouldn't have someone refuse. You would just talk about it more. But that's one of the ideas. And I find it egregious at this point that we have so much evidence about the safety of home birth that they would never portray medical practitioner, like doctors, in such a poor way. There's such good evidence that there's just no good excuse for people doing a film like this to not understand and do the research around home birth. But this idea of the woman who's like, no, I'm staying home no matter what happens, like people, and it kind of reinforces that idea that to have a home birth, you're inherently selfish. You're not primarily concerned about your baby, where at the end of the day, everyone's primary concern is the health of their baby. And so it's really this idea, like, I'm going to stay home because that was my plan. I mean, yes, sometimes people are disappointed they have to go to hospital, and you do more debriefing around it because it usually means that, the plan has gone from a more physiologic or natural birth to one that's more complicated. But it's not that people are against wanting to go to the hospital. People are in favor of having healthy babies. And so that scene in the movie where, again, it's that stereotype that to have a home birth, you're selfish. You're doing it because you're only thinking about your own experience and you're not that concerned about your baby. And then look what happens. You get punished and your baby dies.
And I guess that trope is just a shorthand for, like, Kevin, you mentioned that the director, the screenwriter and director wanted to, they're basing this on an experience of having a miscarriage, which is very different from having, a tragic home birth like this, but they needed to manipulate it so that you could have this tragic scenario. Like that's a way to push the narrative to that conclusion, right?
Well, this is the issue with pregnancy in movies in general, is that it's not often a regular pregnancy, or labor is like really long. And it's like, you don't have 10 hours to show it in a movie or whatever it is, right? Yeah. So they have to create a dramatic tension and scenario in order to make the pregnancy dramatic. So you have all these films where people just think like having a baby is not like an everyday thing. It's this dramatic, like crazy event that's like really over the top or something.
And I think that the movie really, like, the birth could have happened in the hospital. I mean, basically what it comes down to is the woman chose something that maybe not everyone would have, she made a choice that not everyone perhaps would have agreed with in having a home birth. But really the fact that the baby was born at home, like, people make those choices in the hospital too. And I think that they would have been able to explore the same themes of autonomy and choice and forgiveness and guilt. The fact that the birth happened at home, I think, is probably just to make it a little bit more dramatic and to get people talking about it.
Right.
To me, I mean, you had mentioned what the movie was about. To me, really, the movie is about loss and like childbirth related loss, and how much of a strain it puts on the family unit and how different people respond differently. We often think of grief, you know, in some movies like it's a bonding thing and everyone's going through the same thing at the same time, but grief often doesn't play out that way. It's that everybody's going through their own pain and have a really hard time supporting each other. So I mean, I think they did a really good job of showing how much it affects the couple's relationship and sexuality, and you know, that even things like having sex when you have a childbirth related loss become very loaded because it's kind of associated in a way. But I didn't think, like, I think they did that part well and they acted that part out really well. And I almost felt like the home birth idea detracted from all of that. Like it wasn't necessary. And it also then made it be like they were grieving about the mistake for a home birth versus grieving the very real loss of a child, which is something that happens, and it's tragic when it happens, that our society never talks about. And so I felt a little bit like they almost took away from how important of a movie this could have been, because really it's about grief. And instead they added this twist about home birth so that in people's minds it'll be about home birth.
One of the things Katja Weber, the screenwriter, said, and also Angelina Jolie, when she made the movie By the Sea, which, spoiler alert, is about a woman who's, again, her behavior is sort of, you don't understand why it's happening. And then at the end of the film, you find out she's had a miscarriage, and that's affected her, again, the sex life with the husband played by Brad Pitt in that movie. But both filmmakers have said, like, oh, I haven't seen this represented in movies, and I don't really have anyone to talk about it with. And obviously, like, I mean, I can think of a number of people who I know that have had a miscarriage, but do you find that there's just this sort of like, that people don't talk about this? This is still like a taboo subject, the loss of a child, whether it's in the kind of the childbirth process or before that?
Absolutely. Like I would say, I think it's one of society's dirty little secrets. Like miscarriage rates are 1/3 to 1/4 of all people will lose a baby in the first trimester. And it's amazing how much people feel like they're the only ones they know that have gone through it until they start talking to people, and then they realize, oh my God, there's all these women, there's all these people in my family who've gone through it. That I think that's one of the really big problems with our society, is that we only talk about pregnancy in this very celebratory way, where actually it can also be incredibly heartbreaking. I mean, the death of a child at term, like what happened in the movie, is definitely not as common. But there's actually good research now to show that people who go through a miscarriage experience the same level of loss as if they lost a child at term, that it's that profound in terms of how distressing it is. And one of the biggest things I find is not just how isolated people are who go through that experience, but how isolated couples are. Like, as much as very few people talk about it, women in general or pregnant people tend to have places they can go and know other pregnant people, but men or partners in particular, no, they have nobody to talk to about such a profound loss.
Now would be a good time to plug the Pregnancy and Infant Loss Network for folks. It's a really, really great resource. I believe the AOM has a link to it on their website for folks that.
And AOM, when Hannah says AOM, is Association of Ontario Midwives, and the Pregnancy and Infant Loss Network, PAIL, it's called the PAIL Network. And it actually, and I would even say Bereaved Families of Ontario, and they have chapters all over the country, that those are really good resources. Bereaved families, almost like they have chapters or, you know, branches that deal exclusively with childbirth related loss. So it's not just the loss of children. It's actually very much related to childbirth related loss. And I think, you know, often when we have clients who've gone through something like that and you're looking for a caregiver or a counselor, you realize how few counselors there are that actually deal with childbirth related loss. So for sure, I would say, like what you were saying, the directors were saying that, like, that, you know, there's just no information out there. There really isn't. And in that way, that's where I feel like they did a beautiful job. The actors really did a great job of showing how each of them were kind of going through their own individual grieving process. And I feel like the home birth part just kind of detracted from all of that and was unnecessary.
It's interesting because the home birth part is also, it's going to be the one thing that we all I mean, everyone's going to walk away from with all the attention because it's actually directed really, really well. Like as a single take, like, you know, like bravura showcase of filmmaking, like they purposely made that scene like even more exciting, or so exciting is maybe not the right word, but as a, you know, in terms of like what a film critic or what an audience might take away from it, they really like pulled out all stops and just in delivering that scene.
Or even the part where the husband goes outside and he's waving down the ambulance, like it also shows how we're not integrated into the healthcare system, where it's us on the phone with the paramedics, us on the phone with the hospital saying, this is what's happening, this is what I need when I come in, I need a C-section room that's ready for me, that we're the ones directing what's happening versus this, oh my God, I have no idea, please just go outside and flag down like the paramedics.
Call an Uber.
I want to ask a couple questions about specifics of the birth scene, because even just watching it myself, again, I've talked how many friends I've talked to or family members, my mother, that have had babies. I still was the scene where she's burping and has the nausea at the beginning of the scene. How accurate was that? And was that
some people burp, but I didn't understand. Like I was like, are they going somewhere with that? Like I was like, is she gonna end up having some weird like I thought she was going to end up with HELLP syndrome or something. Like I couldn't figure out why she was burping so much. It was like they talked to one person who said they had a lot of gas in labor, and that became the big thing. I mean, yes, people burp just like they pass gas in other ways, but it's not the thing. It was very weird. It was very weird.
And then what about this sort of trope of bathtub? Because another thing I'm like, oh, the home birth, the baby's going to be born in the bathtub. They take her to the bathtub, but the baby is not born in the bathtub.
And they don't put enough water in the bathtub. It doesn't even cover her belly. I was like, why are you even in there? I
thought the same thing. I was like, you're going to be freezing in there.
Yeah, it's not even doing anything.
It's almost like you can't have anything with a midwife without somebody in water. And water, I mean, it can be therapeutic. I always just say, like, you know, if you're the kind of person when you're in pain that likes to go in the shower or the bath, then you might enjoy it in labor. But one of the biggest media depictions of midwives is about people being in the water. And somehow, and exactly what happened with the midwife, that if you're in the water, then nobody's listening to the baby's heart, which is not true. The Doppler, the machine that we listen with, they're waterproof. So you are listening in the water. And some people I would argue, even listen more in the water to make sure that the temperature changes aren't affecting the baby or anything like that. But yeah, it was really, the burping was bizarre. I kept thinking they were like going somewhere with that, or that was going to end up being some sign of some weird, bizarre complication.
I wonder if it was like a metaphor for something. I don't know.
What did you think of Molly Parker's performance in that scene? Did you recognize anything about it? Did you feel like she'd done her homework, or did you her whole demeanor? Because obviously the Vanessa Kirby's character she says she's scared, she's terrified, she's not handling it well, and then Molly Parker is very reassuring and kind of almost has this like otherworldly glow.
Yeah, the hippie, like, everything's okay, and which is good because you want midwives to be calm, but you don't want them to be incompetent calm. Like she was calm.
Why do they always look like that?
I don't know. They always look like that. It's always that kind of older Earth Mother kind of vibe that you get.
Like
And
with the Mennonite hairdo, I don't know.
yeah, always it's true, always with the Mennonite hairdo. I thought she was like, and this is really disturbing to me, but I thought she was almost irrelevant. Like she was such a non-character in her, it was just like, oh yeah, this is really, really hard. I mean, she did like 2 things with labor support, and then when she said, I'm going to set up my equipment, finally, I was like, oh great, they're going to show equipment. And then all she did was put baby blankets on the bed. So I found her, and even in the courtroom scene, like she just had this, and when the baby was born and started crying, she looked in the mirror, and it was this moment of like, oh, thank God, we had good luck that everything was okay, versus I have skill and I know what I'm doing. So
And
I thought Vanessa Kirby was really good in the depiction of labor, but I thought the midwife was ridiculous.
And you would never turn away from a woman who had yet to deliver the placenta. Like you're not going to just be like, okay, like job's done, great, let me go look at myself in the mirror. Yeah, and I thought she was a little bit like she didn't have the midwives that I know, especially the ones that have been practicing for a long time, just have so much have guts, like they have grit. And I think that the portrayal of that midwife was kind of like, and that's just not, I don't know any midwives like that. Like it's a hard job and you have to be really smart and you have to be really strong. And she wasn't that.
The one thing about the midwife was that she wasn't directed, like we didn't see any show of skills. So she did at one point tell the woman to change position when the baby's heart rate wasn't great, but that was the extent of her direction, or the rest of it, it was like her kind of hoping things worked out.
I wanted to ask if you feel like you've seen, you've said you haven't seen really any accurate depictions of midwives in pop culture, but what about just in terms of childbirth, pregnancy in general in films? Like before this, I went on moms.com and looked up their listicle of the most accurate childbirth scenes, and number 1 was actually the Mel Gibson movie Apocalypto, which takes place in like Mayan civilization, obviously before the advent of modern medicine. And then number 2 was Juno. But I was wondering,
I like Juno.
Yeah, what do you recommend parents to be, look to for, if you recommend any kind of like popular culture media where you would say, oh, they did a good job of showing something?
I don't think I've seen it. Maybe Monaby has. I haven't seen a movie that's done a very good job.
No, me neither.
I've seen lots of bad jobs.
I thought Vanessa Kirby did a good job in her acting of labor. But yeah, a movie itself that shows childbirth well. I mean, it's so sad. Childbirth, it's the number 1 reason people are admitted to hospital. It's so sad that we can't think of one easily off the top of our heads.
I read The Cactus recently, and they did a really good job of both pregnancy, labor, and postpartum. So if folks are looking for something.
I have to say,
I mean, unfortunately.
I was going to say, because I felt very uninformed when we had our first child too, right? Like, I mean, first of all, on the miscarriage thing, we had no idea about that, and that we did go through that experience. But B, even childbirth, I didn't know a woman lets it all out, like in the process of, like, that was new to me. Kevin, did you know this, that they have like a kind of a diaper sheet in the thing? Because your mom tells you everything.
I ask all my friends like all those questions.
So first you pee, then you poo, then you can have a baby.
No, and often people vomit. Like it's a big show of bodily fluid. That's what I would say. Like all the bodily fluids are involved. But and the poo thing, I always have to qualify it, because I think women are really afraid they're going to have a massive bowel movement in front of everybody. But really, it's almost like the last bit of toothpaste you're squeezing out of the toothpaste. Like as the baby comes around the pubic bone, it just kind of squeezes what's left in the rectum. So it's not a lot, but people don't realize it's part of it at all. Yeah, no, they're really,
it's not super glamorous.
no, it's definitely not glam. But it's also not as humiliating as I think some people think it's going to be. Like, some people think it's going to be so humiliating they'd rather have surgery. And I worry about that as an idea also. And if I thought I was going to lie there with my legs open and take a massive dump in front of everybody, I don't think I'd want to do that either. Like,
I always tell people, like, you're not even going to know you pooped.
That's what I say.
Yeah.
And if you're good at your job, you wipe it away and you manage it in a way that it doesn't smell in the room and nobody knows.
Usually I celebrate, like, oh, you feel like you have to poo. That's great.
Yeah, because then the baby's
coming.
Then it's almost time to push.